Well, now we've had a good moan about what menopause actually is and what it feels like, because it is crap, innit? Why don't we be a bit more proactive and start talking about what we can do to alleviate symptoms? So maybe we start with the physical, and by physical I mean non-sexual, emotional ones. So things like hot flushes, things like achy joints, brain fog. Is there anything that we could be doing that can improve things for us? And I know it's going to be quite different. We'll probably have to break this down here into like HRT and non-HRT, because I'm someone who is hormone positive cancer. So the joy of going to someone, I'm in medical menopause, and I'm like, should go on HRT. I'm like, no, love. No, I can't. And trying to explain that to someone, and it is one of my most frustrating things about it, is that I just can't wallop a tablet and make it all better. So can we like run through the different variations? What are there for people who might be triple, like if they're breast cancer, triple neg, or another cancer where hormone isn't a factor, and for those that are?
Yeah. Do you want me to start?
Yeah, let's go for it.
Well, if I'll start about HRT, and then maybe Heather can talk about other things, other treatments. So HRT is only 3 letters, hormone replacement therapy, and the contraceptive pill is a type of hormone replacement. So thyroxine, insulin, is a type of hormone replacement. So when people talk about HRT, they just think it causes breast cancer, and that's enough for the conversation for a lot of people. Whereas actually, when you look at the hormone replacement therapy, there are different types, there are different doses, there are different ways of having it. The safest way is having estrogen through the skin as a patch or gel. And then if women have still got a womb, then they should have a progesterone. There's a natural body-identical progesterone, which is safer, or some women use a Mirena coil because it's good for contraception as well. And then some women also benefit from testosterone, which, although is a male hormone, actually I didn't realise until recently that women produce more testosterone than estrogen before the menopause, and then it goes as our hormones go. And testosterone can be very good for libido, but it can also be very good for mood, energy, concentration, stamina. That sort of joie de vie can come back with testosterone. So there are different hormones. There are a lot of women, as you quite rightly say, who wouldn't choose HRT first line, especially women who have an estrogen receptor positive cancer, which often is breast cancer, but sometimes uterine or womb cancer. But a lot of other cancers actually can be treated with HRT. And I've lost count the number of women that I've seen in my clinic or liaise with on social media who have been told they can't have HRT because they've had cancer. Well, that's not right. So people who've had cervical cancer, for example, can still usually safely take HRT. I saw someone recently in my clinic who'd had vaginal cancer, and it had taken a long time for her to be diagnosed. She was only 36. And she'd had horrendous treatment, and everyone just said, well, you can't have HRT, but also no one told her that she could even have sex again. No one had given her any treatment at all. So it's really important that women are individualised with treatment, and if you have had a type of cancer, your oncologist might not even know anything about HRT, so you should try and see someone who specialises in the menopause to know, firstly, can I have it? And if I can, are there certain types that I can have? So I think that's a really important question, because we know that replacing the hormones is the best way of managing the symptoms, but also future health. So for the majority of women, the benefits do outweigh the risks. But there are other ways of having estrogen in our body, and we've talked already, which is great, about vaginal dryness. Talking about vaginal dryness, actually, we've got estrogen receptors on our bladders and our pelvic floor. So it's not just the dryness, it can be urinary symptoms. So people get recurrent urinary tract infections, they can get cystitis, they can get incontinence, so coughing, sneezing's not so easy, and all that can improve.
Pelvic, like pain, like tightness?
Yeah. You can get anything.
Wow.
I mean, you really
that will
can.
explain that then.
But I think when people think about HRT, they think about it just going into the whole body, whereas a local estrogen is very different, and it needs to be made aware how different it is, because there's a lot of people out there suffering that shouldn't.
Thank you so much. And Heather and Maria, can you shine a bit of light on like alternatives? So I know that for hot flushes, I've done a lot of you girls as well, done acupuncture.
Oh, it didn't work for me.
You didn't work for you?
No.
See, it worked for me. So individual, isn't it? What other things can we be doing to improve our symptoms outside of the meds?
So I can talk about simple stuff, and then do you want to talk about the prescribed things? Yeah. Okay, so first of all, just to clarify, there are very few women who could never take HRT. but there are some for whom it would be very difficult. There are even less women who could never use the vaginal estrogen. But as Louise referred to, the most important thing is don't read the leaflet in the pack because it's unnecessarily scary. So moving on from hormones, we always start with diet and lifestyle advice, which may sound a bit, well, how on earth is that going to work? But actually, sometimes cutting down caffeine, cutting down alcohol.
All the good stuff.
Exactly. Keeping an eye on your weight, not smoking. So people who smoke tend to have earlier menopause, worse symptoms. So those simple things can actually make a difference. But also, and maybe they're not going to get the flushes away completely, but may make them more manageable. But also, by making those changes, you're also improving your health later on. So not smoking is better for your bones. Too much caffeine, alcohol, that's not so good for your bones. So there's that really general stuff that is really helpful. There are lots of things you can buy over the counter, and the problem is that if we're really worried about someone taking estrogen, some of these alternative therapies, we have even less evidence about what their action is. And so, although in the NICE guideline that Louise referred to, it did mention that for treating the hot flushes and sweats, what we call vasomotor symptoms, that actually some of the alternatives, the isoflavones, that's the red clover preparations, and black cohosh can be helpful. We have very little evidence about what the effect would be in women, for example, who've had hormone-dependent positive breast cancer. So would be quite wary of using those. A lot of the preparations available haven't been shown to be effective. The most effective thing is going to be giving back estrogen, but then we have to look at what else we can do when that's not possible. Yoga can be helpful. So there is some trials that have looked at the use of yoga. You mentioned acupuncture. Yeah. The evidence around that is a bit uncertain. So some studies have shown it can help, others not. But if you find something that you find helpful and it's not harmful, that's fantastic.
So if you can't take HRT, which most people can, there are only a few cancers, the estrogen receptor positive breast cancers and certain other cancers where you can't. But if you can't, there are other medications that you can be prescribed for hot flushes. Venlafaxine is something that can be given. That's actually an antidepressant, but in higher doses it's been clinically found to be very helpful in reducing the severity and how often hot flushes occur. There's also something called gabapentin. Gabapentin is actually a painkiller which is used for certain types of pain, which has also been found to be very clinically shown to be beneficial in reducing hot flushes if you can't take estrogen. But I just want to sort of reiterate the point that actually the majority of women can take HRT, but we see a lot of young women who come to the menopause clinic who'll say, yeah, I can, but I'm a little bit afraid to take it because, my mother says I'm going to get cancer. And of course, if you've had a diagnosis of cancer, you are heightened to the fear that will come back. But actually, what happens when you are taking estrogen before the natural age of menopause is you're just bringing it back to the level that it would be for someone of your age. So imagine it's like a thyroid disorder where your body isn't producing that anymore and you're just bringing it back to normal levels. You're not pushing it beyond what someone of your age should be having. So you're not actually increasing your risk of breast disease, cardiovascular strokes and DVTs, which is what a lot of girls come and say, I'm afraid to try. So be aware of that you're in a different cohort from the women who are going through the menopause at the average time, and therefore your different risks apply, and they don't actually. But a lot of girls come with that fear.